Welcome back. We have BC's newest health minister joining us on the show today, Adrian. Welcome to Kamloops. Welcome back to town.
Great to be in Kamloops.
Yeah, congratulations on your most recent assignment to this portfolio.
Thank you very much.
Yes, how's it going so far?
Well, the reason I'm here, and one of the most moving parts of my job has been to meet with healthcare workers in Prince George and in Williams Lake and in 100 Mile and today in Kamloops, who just did extraordinary things. I think it's fair to call them heroic things. It's quiet heroism, but it's real heroism.
Yes.
I mean, we have people, I talked to the people who work on the physical plant at Ponderosa today who prepared the third floor at Ponderosa, and people who know that facility know that it's usually not used, in basically 15 hours to welcome dozens and dozens of new residents, like 80 new residents in a facility that currently has 91 residents. We saw the same thing in Prince George, where a similar facility, public facility, Gateway, doubled in size in a day. And so this is extraordinary things. We saw workers coming down from 100 Mile to assist in that. And just the generosity of the whole community of Kamloops, of course, but the real generosity of healthcare workers who, it's sometimes we say above and beyond, it's above and beyond that, what people did in Kamloops.
We already have a huge base of volunteers in this town, and so I'm not surprised at all to see our numbers come out the way they have to help people in the wildfires, and the nursing and the care aides. Everybody's worked together, there's no question of that. So it's great.
It really shows what the public healthcare system, when it's most valuable.
Absolutely.
Like we've seen, and we don't want to comment on the American example too much, but we've seen in some cases of natural disaster in the United States, and this is a natural disaster we've gone through this summer. Here, where we don't have those public systems in place, and those public systems, it was places like Royal Inland and Ponderosa and Gateway, and all of our hospitals and healthcare facilities that did an extraordinary job. There are things that they would all say they could do better if they had more time to prepare. They didn't. These things happened very quickly, and people did extraordinarily well. And of course, we're going to learn lessons from this as well.
Absolutely. Going forward, we're pretty excited here in Kamloops, of course, with Royal Inland Hospital. Before you became the minister, of course, we had this promise of a surgical tower coming to Royal Inland Hospital. We're certainly hoping that's still going to happen. It's
going to happen. It's on. We've been advocating. I've been advocating for it. As you know, I've come to Kamloops. I was the health critic for 6 years, and I was leader of the opposition. And in both of those capacities, I was saying, I was demanding that happen. And so I'm delighted that the patient care tower is going to be ready, we believe, for 2022. The next phase is going to be the shortlisted bidders, which is in October. We're on the path for that. Interior Health tells me that. The Ministry of Health tells me that. And my instruction from John Horgan is to get it done.
Okay.
And that's our plan. And if there's any way we can get it done quicker than planned, we will. But it's on schedule.
Let's quickly talk doctor shortage as well. In Kamloops, we have a shortage, as you are aware. We have nurse practitioners now that work out of a clinic on the North Shore, and they are really helping to work as a stopgap for the lack of doctors. And people have access now to this health care that they didn't before. Is that something we're going to see more of moving forward?
I think so. Nurse practitioners really came into being in BC as a group in 2006. They haven't always been used as well as they should have been, but obviously nurse practitioners on their own can do remarkable things for patients. I have type 1 diabetes, so I have a chronic disease, and people who have my chronic disease really benefit from the time that a nurse practitioner is able to give and their enormous range of skills. But obviously, we need more doctors as well. The previous government and the previous minister, and I'm not going to say anything critical about him today. You know, my first visit to his hometown, I'm going to be really nice. People were trying.
Out there watching.
People were trying. But clearly, they went through a very extensive effort. They called it GP for me. They said everyone was going to get a family doctor. They said it just before the 2013 election. Okay, that might be a little bit critical. And it didn't happen. We have basically the same numbers today in family doctors as we had then. And so we've got to do some new things. And I was here this morning meeting with family doctors to talk about that, the things we could do to do better. That was first meeting with the Division of Family Practice today. And obviously improving primary care in Kamloops, which I think is, you know, if you look across Interior Health, the community that's struggling most with primary care right now is a top priority, and we're on that. And obviously, even though the patient care tower is a really important thing, it's going to be ready in 5 years. That's a long time.
It is.
And we've got to make improvements to healthcare before that, and we're determined to do that right here in Kamloops. I think this should be a model community.
Yes.
And it's one that I care a great deal about in terms of healthcare. I think we have to do better than we have. I think there's the will to do that amongst doctors and nurse practitioners and the community in Kamloops, and it's my job to help make that happen.
There's no question in my mind, Adrian, that the health portfolio, I think, is the most daunting portfolio in the entire government. I mean, so many of our tax dollars go into this. There's no quick fix to the doctor shortage. You know, say what you want about the past government, but you won't be able to do a cure-all and a fix-all like this either. I mean, there's a lot of struggle involved in this.
Of course there is, but I think that it's so important to a community such as Kamloops. It's so important, it's of course important for healthcare, but it's also important for the entire economy of the region. People come to communities that have outstanding healthcare, have outstanding schools, have outstanding post-secondary institutions. These are important to the life, and of course they employ a tremendous number of people. I think we can do better. I know efforts were made, and I give credit for those efforts to Terry Lake and to others, but we've got to do better. I think he would acknowledge that, and I'm going to work hard to see that happens.
Fantastic. We're out of time. There's about 7 more questions I'd love to ask you, but I got to throw to a break.
Well, there you go.
You got to come back to town then and come back on the show.
I've got to come back to town and ask your next guest about the evacuees he took in, because everybody in Kamloops really pitched in.
I will. I'll ask that. It must be Larry Mackey you're talking about.
I'm talking about Larry.
Good guy.
Yeah.
Thank you for being here today. We've got Adrian's Twitter address, handle rather, on the screen, as well as his information, the email as well, if you'd like to get a hold of him. I'm sure he'd love to hear from you. Back after a quick break. Stay with us.